Hey guys, it's Dr. Emer. Turn up the music. Hey guys, it's Dr. Emer. We're in West Hollywood, and it's end of the week before 4th of July, so we're getting our last minute patients in. And I have this beautiful woman here today who is willing to educate you guys a little bit on hair loss. You know, I posted yesterday and a lot on Instagram this past week about using a combination of growth factors from your own blood and stem cell products to improve the appearance of hair, to thicken the hair, to darken the hair, and to get more hair to grow. The issue we have here is I have a female that has a mixture of different things that have occurred that has stressed out her body to cause hair loss. And if you look at the frontal hairline, some of her hair, there's actually no follicles in there. So those are areas where the best treatment would actually be transplant, which I think she has done in the past, right?
She has.
Had done in the past. However, we can improve the hairs around there and also the ones that are still growing with a combination of PRP, which is growth factors from your own blood, and a stem cell product called ACELL, which is bladder epithelial matrix cells. Basically, think of this: your bladder cells are constantly being damaged. You're peeing all the time, toxins are going through them, it's being detoxified. Those cells are some of the most replicating cells in your body. They're stem cells that are there that are over and over regenerating. By adding them to the PRP, it gives the PRP an enhanced, it's a boost, it's like a steroid for your PRP, and it makes the cells in the hair grow better and go out of a resting phase to a waking up phase. Okay, that's basically what is happening here. So we're going to inject it, and most women, just really quickly, women typically lose in the frontal parietal area. Some people call it triangular alopecia, where they lose a little bit of hair in the temple, but also back through the part width, where they part their hair down to the back and typically not around the edges. So my beautiful woman here today has hair loss in the front, which is primary, and then a little bit going along the part width to the vertex of the scalp. We're going to need to do a series of treatments. Typically we do monthly treatments, somewhere 3 to 6, because it takes about 3 to 6 months for your cycle to turn over. Then we reassess, and typically I would tell someone like her every 3 or 4 months forever. You'd have to do those treatments, and then if we wanted to do more transplant to build, we could. If not, we just keep doing this. Little things like adding Latisse to the hairline, a product made by a company called Restorsi, a spray that has a fish enzyme that detoxifies the surface of the scalp, helps nutrients get in, really help, and sometimes you can even inject the brows if you needed to. So I'm going to start the treatment. Bear with me. We don't really do much anesthesia because typically it just gets in the way, and I always tell people it's a little poke. It's not the best feeling in the world, but it goes really quickly. We just do a quick injection. How much pain is it?
¿Le duele mucho?
No.
Not much. So that's what I'm saying is, you know, you can do it with anesthesia. The issue is it gets all over the place, and then the people leave with gel all over their hair, and it just always was, you know, it's more like a bug bite. I'd rather just do a little bug bite. It makes it easier. And we used to do a cold spray. I used to do Zimmer cooler. I used to do nerve blocks. I feel like I'm aging myself now.
Could you do this to your eyebrows?
You can, that's what we just said. So we just said, yeah, you can. You can do it to the eyebrows. We're going to go a little more superficial here because we're going a little closer to the frontal of the hairline. We want that area to spread with the product, the growth factor products. Okay, and you can see we're blebbing up in those areas. She's doing really great.
Somebody's saying, are you implying no one can be bald?
Oh, look at me. I shave my head. I don't mind. Anyone can be bald if they like. Some people want to and some don't, you know?
How thick does it grow back usually?
It just depends. Everybody's different. You know, some people, their hair grows really dramatically after these, and some people it just takes numerous treatments. Just so you know, I've been doing my treatment every 3 months in my head for almost 8 years. So in general, this is something you're going to do as a maintenance therapy forever, because no matter what, as you age, hair thins. No matter what you do, the hair is going to thin. So by doing this, you're slowing down that process. Now, how quickly we're slowing it down, that's another story. That just depends on your own body's metabolism and things. You know, we can't predict what your body wants to do. Good. Okay. Now I'm going to have you lean forward just a little bit. Very good. So I'm going to show you guys here. We're just going to go through now. We're going to go up to the vertex here of the scalp. You can see that's where she has some loss. And that's where we're gonna go do a little bit more of the product. We're almost there, the final. Good. Now I do a little less blebs, a little more in one injection, because I find that it spreads enough and it stimulates a whole host of responses that we really don't need to have a lot of little baby injection points. But we're following each of the areas along her parts to get a nice big bleb right into the cells of the hair follicles. Perfect. We have one more left. Go ahead and lay back again. Perfect. I'm just gonna let the front go down a little bit, and because the area of concern to her is mainly the front, we're gonna go back and add a little bit more, just to really fill up the growth factors in this area, because I want her to see the most result if she can in the temple area and lateral. Perfect. All done. So ask her how much pain.
Está bien, ¿cómo?
So see, everyone says I torture people when they watch my videos, but my patient's not punching me and she's not hitting the staff, so we're okay. So it's really not so bad, but basically the process now will start. So you have to think of this as exercise for your scalp. If you stop going to the gym, your body loses its tone, it loses its muscle. If you stop doing these injections, the hair goes back to its natural process of losing the thickness, the luster, the vitality, etc. So we start a process up front where we do the multiple series of injections in combination, typically monthly for 3 to 6 months, and then we go every few months after that forever as your maintenance. Just like you would clean your teeth or get your hair brushed, you get your hair cleaned and hair dyed. We're going to inject your hair to get the nutrients so that you don't lose it as you age. All right, it's the start of her process, and we'll see it as we go forward. Thank you. You did good.